Is your back pain coming from tight quads? Back pain is a common complaint for people of all ages. And while most of us focus on the spine itself, the real cause of discomfort may be coming from somewhere else, like your quadriceps. These are the large muscles at the front of your thighs, and believe it or not, they can play a huge role in how your back feels. What are the quadriceps? The quadriceps consist of 4 muscles located at the front of your thigh: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. They're responsible for straightening the knee and helping with hip movement, especially hip flexion. One of these muscles, the rectus femoris, attaches at both the knee and the pelvis, making it especially important when talking about posture and spinal health. How tight quads affect your lower back? When your quads, especially the rectus femoris, become tight from overuse or prolonged sitting, they pull the pelvis forward into an anterior tilt. This means your pelvis tips down in the front, exaggerating the curve in your lower back. This postural shift puts additional stress on your lumbar spine and surrounding muscles, often resulting in lower back pain, muscle tension, and even pinched nerves. In simple terms, tight quads pull your pelvis out of alignment, which throws off your spine and causes back pain. Common causes of tight quads: sitting too much. Prolonged sitting shortens the hip flexors and quads, making them tighter over time. Lack of stretching. If you work out or walk a lot but never stretch your legs, the muscles may lose flexibility. Overtraining activities like running, cycling, or squats can overwork the quads, especially without proper recovery. Poor posture, slouching, or standing with a forward-tilted pelvis can increase tension in the quadriceps. Symptoms of tight quads affecting your back: a feeling of tightness in the front of your thighs, an exaggerated lower back arch, discomfort in the lower back, especially after standing or walking, difficulty bending forward or leaning back comfortably. Pain that improves after stretching the legs. If these sound familiar, your tight quads might be part of the problem. How to test it yourself? Try this simple test. Lie face down and bend one knee to bring your heel toward your butt. If you feel strong resistance or fatigue, get your heel close to your body without pain or lifting your hip. Your quads are likely tight. You can also try standing and doing a quad stretch fit. It's hard to hold your ankle, or if your lower back arches dramatically when you do, that's another sign. How to fix it? 1. Stretch regularly. Incorporate daily quad and hip flexor stretches into your routine. Some good options include the standing quad stretch, the couch stretch, and the pigeon pose for deeper hip release. 2. Foam rolling. Use a foam roller to massage your quads and hip flexors. Rolling out these muscles can improve blood flow, break up knots, and improve flexibility. 3. Strengthen the glutes and core. Weak glutes and core muscles can contribute to pelvic misalignment. Try exercises like bridges, planks, and bird dogs to restore balance. 4. Be mindful of posture. Work on keeping a neutral pelvis, especially when sitting or walking. Avoid slouching or arching your back too much. 5. Take breaks from sitting. Stand up and stretch every 30 to 60 minutes. If you sit for long periods during work or driving. Final thoughts: your back pain may not be coming from where you think. While spinal issues are one cause, tight quads are an often overlooked culprit, especially for people who sit often, train their legs hard, or ignore stretching. Addressing tight quads can relieve pressure on the spine and significantly improve your posture, mobility, and overall comfort. If you've tried everything for your back pain with no luck, it might be time to look a little lower. Fix your quads and your back might thank you.
Like, subscribe, follow for your free back pain relief ebook.